PEPFAR. Saving lives. Investing in people. PEPFAR. Partnering for an AIDS-free generation.
In South Africa, despite an enabling policy environment, men who have sex with men, MSM, and transgender individuals often experience discrimination and violence in their daily lives. While these key populations are also vulnerable to HIV infection, they do not always have access to the same HIV services as the general population.
Currently in this country, we have one of the best constitution in the world. No one can disregard the constitution we have. But in terms of practice, there's a disconnection. And the disconnection is, people, LGBTI people experience stigma, experience discrimination in services.
I can remember from the very outset when this secret illness was discovered and people didn't know what it was, and there was a lot of confusion and unfortunately also a lot of sadness because many people died in the process.
People are still quite afraid sometimes to access services from mainstream government clinic services. They feel that they might be humiliated. People also are sometimes victimized in the mainstream public health system.
Very few organizations were trying to address key populations. Fortunately, now the government recognizes that these are very important populations, and in the new National Strategic Plan for HIV, TB, and sexually transmitted infections, it is recognized that we need to bring services to sex workers, to men who have sex with men, and to other vulnerable populations if we're going to have an impact, a broader impact on the general epidemic.
CDC, PEPFAR, and USAID, along with other delivery partners, work to expand access to non-discriminatory HIV-related services for key populations. Alternative care services have increased to include ICAP, the International Center for AIDS Care and Treatment Programs, its subsidiary OUT, Anova Health for Men, and the MSM Centers of Excellence throughout the country.
Our key populations, especially MSM, does not make use of our healthcare services because of stigma and discrimination and so on. So a huge part of our sensitization of healthcare professionals is then part of our training is to destigmatize.
Whether the person is heterosexual, homosexual, transgender, that is something that I need not to be scared of, because we give them the skills to say, this is how you need to talk about this. These are the kind of examinations what you need to do. These are the other questions that you need to ask, because you cannot make assumptions.
We've managed to be able to accommodate every single individual, whether they're coming from a background where they are black or white, or they're coming from the background where they are in the countries where it's not even easy for them to declare their sexuality.
I want them to be comfortable with me. I want them to interact with me, tell me exactly what happened, this kind of sex they had, this and that, how long ago it happened, the signs, symptoms they have at the moment.
That we recruit peer educators from around the communities in Pretoria, who are then trained on HIV and AIDS-related issues, as well as any other issues which might actually, be faced by the LGBTI community. So what we do after the training is that they go out and serve as the link between our services and the communities.
We've seen in our clinic, for example, we started with this Yeovil clinic in 2012 in March when we launched the clinic. We had such a huge number of clients that come into the clinic, and at that time we're sitting at around about 30 to 20% of prevalence of HIV. If you look at now, our statistics are below the 10%, and which is quite good. I mean, within less than 2 years, we've seen a dramatic drop of HIV prevalence and STI.
If I do not engage in the correct manner and in an open kind of environment with a person, I miss an opportunity to assist them with risk reduction, and that's the fight we're fighting.
Because PEPFAR has been open, has said we will support funds, we will support programs that access vulnerable groups. irrespective of sexual orientation, of who you are or where you are. What we want to do is to support people and get access to treatment for all people, because PEPFAR has taken that stand. That has been really, I think, important in terms of opening up the debate, particularly around MSM and particularly in sub-Saharan Africa.
So what PEPFAR and USAID is doing is, for those who are experts in this field, are provided with resources to support and strengthen what our national government is supposed to be doing, but also to strengthen what the National Strategic Plan is saying.
The South African National Strategic Plan for Health will advance the availability of non-discriminatory support for key population groups, ensuring that no one is left behind in the fight against HIV/AIDS.
PEPFAR, partnering for an AIDS-free generation.